Hi there, my name is Jordan Ritchie and I'm a pharmacy extern, and today I'm going to go over blood glucose testing with you using a blood glucometer. So first, you're going to wash your hands with warm water and soap to make sure that they're clean. Then you're going to dry your hands off completely. Before testing, I recommend that you rub your hands together. This will increase the blood flow to the area that we're going to be using for testing. Then you're going to set out your supplies like I have here. This is my lancing device. This is my lancet. These are my test strips, and this is my blood glucometer. So now we're going to begin testing. First, you're going to unscrew the cover off of the lancing device so that you can put the lancet in. Once the lancet has been secured in, you're going to take off the lancet cap and set it aside for later. Then you're going to recover your lancing device. Your lancing device comes with a few gauges, 0 to 5, 5 being a more deeper prick, and then 0 being a more shallow prick. I recommend starting off with a 2.5 to 3, and if you notice that you're getting more blood than you need, you can go to either a lower device setting, so a 1 or a 2, or if you're not getting enough blood, you can go to a more deeper setting, so a 4 or 5. Then we're going to set the device aside. We're going to take our test strip and insert it into our glucometer with the arrow pointing towards the testing device. Now we're going to rest our testing device down, and we're going to wait for a blood droplet to show up on the screen. This is usually a sign that the device is ready for you to put a blood sample on. We're going to take our lancing device, place it firmly against the side of our finger, never on the tip of the finger because that's where the most nerve endings are, and that's going to cause it to hurt even more. Once you're ready, you will press the button on your lancing device, and then you'll hear a click. At this point, blood should be coming out of your finger. You're going to take the test strip and place it gently to the blood sample, and then place the glucometer down. It's a good idea to have a cotton or an alcohol swab nearby for after you're done testing to place onto the testing site. At this point, your machine should be giving you a reading. We're going to go over what those readings mean at the end of the video. Now, what I want you to do is to discard the items that you would have used. You're going to put your container of test strips on the side. You're going to remove the used test strip, and then you're going to open up the lancing device and place the lancet into that lancet cap that you had put down on the side earlier, and then remove. It would be a good idea to have a sharps container nearby so that you can dispose of everything together. And if there's no sharps container, then you're going to place it into either a jug or container that nobody has access to, or into the garbage wrapped up and secured like this. Afterwards, you're going to sanitize all of your testing devices and supplies, and then package them away into your glucometer kit. So in summary, here are some tips to remember when you're doing blood glucose testing. 1, you're going to make sure that all of your equipment has been sanitized, and this is inclusive of your hands, your lancing device, as well as your glucometer. 2, you're going to make sure that when you're pricking your finger with the lancing device, that you prick the sides of your finger and never the tip of the finger. Also, you're going to rotate fingers with testing. 3, you're going to make sure that you know your testing numbers. So this comes with a conversation with your doctor so that you know exactly what your target goal will be. 4, whenever you're discarding any of the materials that you've used, either have a sharps container or a container that you can put your lancet into that nobody would be at risk of pricking themselves with. And then 5, make sure that you record your blood glucose values and you keep it handy for whenever you're going for a doctor's visit. Now that you've taken a blood glucose value, let's talk about what that means. So, it's important to know your target. This is a number that you would discuss with your physician that will tell you what your blood glucose should be either after a meal or fasting before a meal. So, for persons with diabetes, a blood glucose fasting should be between 80 to 130 milligrams per deciliter, whereas somebody who does not have diabetes, a fasting would be between 70 to 99 milligrams per deciliter. When we're talking about a postprandial or a after meal eating, we're looking for a blood glucose of less than 140 milligrams per deciliter for anyone who is not diabetic. And for persons that are diabetic, we're looking for a reading of less than 180 milligrams per deciliter. If your numbers fall too low or way above these targets, then you would want to speak with your physician to get the best recommendation of what to do next. You can always speak with your pharmacist if you're confused about whether or not the number is high or low, or if you're confused about what the numbers even mean. Hi, my name is Jordan Ritchie and I'm a pharmacy extern. Today we're going to go over blood glucose, warm water and soap to make sure that they're clean. Then you're going to dry your hands and then your hands together to increase the warmth to increase blood flow. You're going to want to have a cotton nearby so that you can place onto the wound. You're going to want to have a cotton or let me go. Hi there, my name is Jordan Ritchie and I'm a pharmacy extern, and today I'll be going. My name is Jordan Ritchie and I'm a pharmacy extern. Today we're going to go over blood glucose.